proposal. So please join me in welcoming the 2023 SCI Idealist, Dr. Michael Curry. Congratulations, Michael.
There is so much I want to say, but we don't have the time to do that. I probably would start here. There's an African proverb that I love. It says, if you know the beginning well, the end won't trouble you. So the beginning for me is my mother in the back of the room. And I don't know why. Every time I mention her name in public, I choke up. I don't know what that is. I think about the fact that she was a single mom in Alabama who, there's Alabama in the room, who wanted the warmth of other sons. And like 6 million other folks left the South and moved north for jobs and opportunity and knew no one in Boston and came here to do domestic work. So when I think about an idealist, I think about people who are really thinking outside the box. They're doing things that are not really practical, that you move somewhere without a family, a social a network of folks to take care of you, maybe even without a safety net, because you want to create a better life for your family. She moved here by herself and later sent for her children, and I was born here. And I was born in the projects. And it's so funny when I'm around a lot of other people, they say, Michael, why do you always mention you were born and raised in the projects? And I share with you another quote by Frederick Douglass, who said, it's not just the heights you reach, but the depths from which you come. So I share that today when I think about the work that SCI does and the communities that I come from. I think about the fact that many years, and Jackie Jenkins Scott, who I'm such a fan of the work that she's accomplished and continues to accomplish in her career. And I think about being a kid at Whittier Street Health Center. I got my care at the health center. I later got my care at Roxbury Comprehensive Health Center. We moved further up on Warren Street. And it was a place that we got our teeth and our eyes and our mental health. My sister was addicted to crack at the time, got services. I think about all the things that health center provided for my family. And even if we were food insecure, you can go get a meal at the health center. So it is an honor many years later to come back and represent community health. So I don't know why I'm choking up right now. Sorry. An honor to represent community health centers. The work of racial justice, health equity is a hard one. I often say, I'm glad so many people are woke and others are waking up, but some of us are insomniacs. Cindy Friedman is an insomniac. Jackie Jenkins Scott is an insomniac. Pam is an insomniac. Natanya is an insomniac. That means way before George Floyd, way before COVID-19, folks were in the room raising the equity hand, challenging people to do the right thing, and nobody, or at least most people, weren't listening. And it meant you probably didn't get invited back. It meant that you were probably thought of in a bad way, that this person is disruptive and always brings up things that nobody wants to hear. So I appreciate the insomniacs that I get a chance to work with. I had a chance, of course, I've known Senator Friedman for many years, but I got a chance to work with her on the COVID vaccine working group, and Liz Walker and Wanda McClain, and now the head of the CDC, Rochelle Walensky. And I always say that work of equity is hard, because oftentimes when you raise that hand, you're the skunk in the party. And we were in those rooms, those virtual rooms, Chair Friedman, with really smart people, right? We're talking epidemiologists, doctors with all kind of national and world acclaim for the work that they've done. And we had to say, well, wait a minute, that's not equity. Don't relegate Black and brown communities to Johnson & Johnson and they don't have access to Pfizer and Moderna, because that's not what equity is. Or if you're going to put the vaccines out and you're going to start with certain demographics, you just told me that people who are Black and brown are dying in their 40s and 50s. So make sure that we get to the vaccine for those populations sooner. But that was hard because people push back. Equity is always competing with cost. We can't afford it. It's not convenient. It's not efficient. So I say that to all of you in the room who are willing and bold enough to be idealists and disruptors, to be that person in the room, that we need more of you, because there's a risk that comes with doing it. I'll end it on this, and of course to David and the SCI team. So thank you so much for honoring me, along with two people that I'm a huge fan of the work that they do and allies in this work. I am passionate around health equity because I really feel that, quite frankly, we've gotten weathered to higher rates of disease and death in Black and brown and poor communities. And when I say weathered, of course, there's now a national conversation of weathering. Geronimus, the researcher, looked at women's fertility and looked at Black women's fertility and found that, contrary to opinion at the time, the safest period of time for Black women to have a baby was during her teenage years. At the time, they thought that one of the reasons maternal death and bad outcomes were so bad because Black women were Natanya, having babies at young ages. But Geronimus actually, in her research, proved that actually wasn't the case. It was the weathering over their 20s and 30s that made their pregnancies more risky. It was racism, it was trauma, it was poverty, it was all these social determinants of health that made their babies die. And in many cases, those Black mothers died. But I want to share and leave you with this. That wasn't the example that was shared with me. I think it was Healthcare for All that did this presentation many years ago. And they used the example of asthma, which I had asthma. My mother had asthma. My little sister had asthma. And they asked Black women to rate their kids' asthma from 1 to 10. And many of those mothers in that study rated their kids' asthma as 3, 4s, and 5s. Then the doctors came in and evaluated those same kids, and they were 8, 9s, and 10s. And the researchers that presented us in Healthcare for All said, well, that's weathering, because you can get so used to taking the Alupent and Flovent like I did 2, 3 times a day, like my mother and my sister did. Or you can get so used to sitting at Boston City Hospital, as I did, once a month or once a quarter, that you get weathered to being sick. So I always ask the question, what are you weathered to? Are you weathered to some communities that where right now in Boston, they're living with shootings and drive-bys and deaths in their communities, and we've gotten used to it? Or where if you live in communities like I grew up in, they live 5 and 10 years less than most Americans, most Bostonians, because they're gone too soon, of almost every disease I can name. Are you weathered to the fact that Black women in this room right now, we're celebrating women are living longer with breast cancer, but that's not true for you Black women in this room? So I challenge you, as we celebrate SCI and the work that they do and the phenomenal work they do with young people and the phenomenal work they're doing in our communities, how do you unweather yourself? Because that's the challenge. How do you now become uncomfortable with the conditions that too many of our neighbors face around us? And I'm honored to do that work with some amazing people. Thank you.